Question 1. Regulatory review indicates that initial assessment and history taking in inpatient obstetrics requires a comprehensive understanding of the patient's medical, social, and obstetric history. A patient expresses significant discomfort and reluctance when asked about past traumatic experiences, stating, "I really don't want to talk about that right now." As the admitting nurse, what is the most appropriate initial response to ensure both patient safety and a therapeutic assessment? Option A. Gently acknowledge her feelings, explain the importance of the information for her care, and offer to start with other aspects of her history, assuring her that sensitive topics can be revisited later with her comfort in mind. Option B. Reassure her that her past experiences are not relevant to her current obstetric care, and proceed with gathering only the immediate physical assessment data. Option C. Inform the patient that if she is unwilling to share her full history, the assessment cannot proceed, and she may need to wait until she is more comfortable. Option D. Insist on obtaining a complete history immediately, explaining that all information is critical for her and the baby's safety, and that there is no time to delay. Correct answer is A. Gently acknowledge her feelings, explain the importance of the information for her care, and offer to start with other aspects of her history, assuring her that sensitive topics can be revisited later with her comfort in mind. Explanation. This scenario is professionally challenging because the nurse must balance the immediate need for comprehensive obstetric history with the patient's expressed discomfort and potential for distress. The patient's reluctance to share sensitive information, particularly regarding past trauma, requires a nuanced approach that prioritizes trust building and patient autonomy while still gathering essential clinical data for safe care. The nurse's judgment is critical in determining how to proceed without further alienating the patient or compromising the quality of the assessment. The correct approach represents best professional practice by prioritizing a patient-centered, trauma-informed care model. This aligns with ethical principles of beneficence, acting in the patient's best interest by obtaining necessary information for safe care and non-maleficence, avoiding harm by not re-traumatizing the patient. Specifically, it adheres to guidelines that emphasize establishing rapport, explaining the purpose of the questions, and offering alternatives or deferrals for sensitive topics. This approach respects the patient's dignity and right to privacy, fostering a therapeutic relationship essential for effective obstetric care. An incorrect approach that immediately insists on obtaining all historical details without acknowledging the patient's distress or offering alternatives fails to uphold the ethical principle of respect for autonomy. It risks re-traumatizing the patient, potentially leading to incomplete or inaccurate information if the patient becomes defensive or withdraws. This approach may also violate guidelines related to patient rights and informed consent, as it does not adequately address the patient's comfort level or provide options for managing sensitive disclosures. Another incorrect approach that dismisses the patient's concerns as irrelevant to the obstetric assessment overlooks the profound impact of psychological well-being on physical health, particularly in pregnancy. This demonstrates a lack of understanding of holistic patient care and may contravene professional standards that advocate for addressing the whole person, including their mental and emotional state. It also fails to recognize that past trauma can significantly influence current pregnancy experiences and outcomes. A third incorrect approach that postpones the entire history-taking process due to the patient's initial reluctance, without attempting to gather any essential information or explore the reasons for her discomfort, could compromise patient safety. While respecting boundaries is crucial, delaying critical assessment elements without a clear plan for re-engagement could lead to missed opportunities for early identification of risk factors or complications. This approach may not align with the urgency often required in obstetric settings. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and validate the patient's expressed feelings or concerns. 2. Clearly explain the purpose and importance of the information being requested, linking it directly to her health and the baby's well-being. 3. Assess the patient's readiness to discuss sensitive topics. 4. Offer choices. Proceed with less sensitive information first, deferring specific questions, or explaining how information will be handled confidentially. 5. Reassure the patient that her comfort and safety are paramount. 6. Document the patient's response and the plan for follow-up regarding the history. Question 2. The performance metrics show an increase in adverse neonatal outcomes for infants born to mothers with preeclampsia and diagnosed fetal anomalies. A recent case involved a patient with severe preeclampsia and a known complex cardiac anomaly in the fetus. The admitting team initiated aggressive antihypertensive therapy and fetal monitoring, but did not immediately consult maternal-fetal medicine or neonatology for a joint management plan prior to considering delivery. Which of the following approaches best reflects current best practice for managing such a high-risk pregnancy? Option A. Initiate aggressive antihypertensive therapy and fetal monitoring, and proceed with delivery once maternal hemodynamics are stabilized, without further specialist consultation unless complications arise. Option B. Immediately consult maternal-fetal medicine and neonatology to collaboratively develop a comprehensive management plan that addresses both maternal and fetal risks, guiding decisions on timing and mode of delivery. Option C. Focus solely on maternal stabilization and postpone any discussions about fetal management or delivery timing until the maternal condition is completely resolved. Option D. Proceed with delivery as soon as maternal blood pressure is controlled, prioritizing maternal safety over further fetal assessment or specialized neonatal preparation. The correct answer is A. Initiate aggressive antihypertensive therapy and fetal monitoring, and proceed with delivery once maternal hemodynamics are stabilized, without further specialist consultation unless complications arise. Explanation. Scenario analysis. This scenario presents a common challenge in inpatient obstetrics, managing a patient with a high-risk pregnancy complicated by preeclampsia and a fetal anomaly. The professional challenge lies in balancing the immediate maternal health concerns with the long-term implications for the fetus, while adhering to established clinical guidelines and ethical principles. Accurate assessment, timely intervention, and effective communication are paramount to ensure optimal outcomes for both mother and baby. Correct approach analysis. The correct approach prioritizes a multidisciplinary team consultation, including maternal-fetal medicine specialists and neonatology, to develop a comprehensive management plan. This aligns with best practices in high-risk obstetrics, emphasizing collaborative care and evidence-based decision-making. Consulting specialists ensures that all aspects of the complex maternal and fetal conditions are addressed by experts, leading to a more informed and individualized care plan. This approach upholds the ethical principle of beneficence by seeking the best possible outcomes for both mother and fetus, and it adheres to regulatory guidelines that mandate appropriate consultation for complex cases. Incorrect approaches analysis. One incorrect approach involves solely focusing on maternal stabilization without adequately considering the fetal anomaly and its potential impact on delivery timing or neonatal care. This could lead to suboptimal fetal outcomes or missed opportunities for early intervention for the neonate, potentially violating the principle of beneficence towards the fetus and failing to meet the standard of care for complex high-risk pregnancies. Another incorrect approach is to proceed with immediate delivery without a thorough multidisciplinary assessment and discussion of risks and benefits. This could be premature, especially if maternal stabilization is not yet optimal or if the neonatal team is not prepared, potentially leading to increased neonatal morbidity and mortality. This disregards the ethical imperative to minimize harm and the regulatory requirement for appropriate risk assessment before significant interventions. A third incorrect approach is to delay definitive management of maternal hypertension and fetal monitoring due to concerns about the fetal anomaly without engaging specialists. This inaction can exacerbate maternal complications like eclampsia and lead to fetal distress or demise, representing a failure to act in a timely manner and a breach of the duty of care. It also fails to meet the standard of care for managing severe preeclampsia, which requires prompt and aggressive management. Professional reasoning. Professionals should utilize a systematic approach to high-risk pregnancy management. This involves 1. Thorough assessment of maternal and fetal status, identifying all risk factors. 2. Recognizing the need for specialized expertise when complex conditions are present. 3. Engaging in timely and effective communication with the patient and family, as well as the healthcare team. 4. Collaborating with a multidisciplinary team to develop an evidence-based, individualized care plan. 5. Continuously reassessing the patient's condition and adjusting the plan as needed. This framework ensures that care is patient-centered, evidence-based, and ethically sound, adhering to all relevant regulatory and professional standards. Question 3. The audit findings indicate a pattern of delayed initiation of interventions for concerning fetal heart rate tracings on the labor and delivery unit. Specifically, the review highlights instances where nurses observed late decelerations and minimal variability for extended periods before notifying the physician or certified nurse midwife and repositioning the patient. Which of the following nursing actions best reflects adherence to current obstetric nursing standards of care in managing intrapartum fetal monitoring? Option A. Discontinue fetal monitoring temporarily to allow the patient a break, assuming the pattern is benign if no other signs of distress are present. Option B. Continue to monitor the fetal heart rate closely and document observations, waiting for the pattern to resolve spontaneously before taking further action. Option C. Immediately reposition the laboring patient onto her side, administer supplemental oxygen, and notify the physician or certified nurse midwife of the concerning fetal heart rate pattern. Option D. Interpret the fetal heart rate pattern as fetal distress and initiate immediate emergency procedures without consulting the physician or certified nurse midwife. The correct answer is C. Immediately reposition the laboring patient onto her side, administer supplemental oxygen, and notify the physician or certified nurse midwife of the concerning fetal heart rate pattern. Explanation. The audit findings indicate a need to reinforce fundamental obstetric nursing practices related to fetal monitoring interpretation and intervention. This scenario is professionally challenging because it requires the nurse to synthesize complex physiological data, apply critical thinking under pressure, and make timely, evidence-based decisions that directly impact maternal and fetal well-being. The potential for adverse outcomes necessitates a high degree of vigilance and adherence to established protocols. The correct approach represents best professional practice because it aligns with the American College of Obstetricians and Gynecologists, ACOG, guidelines for intrapartum fetal heart rate monitoring, and the Association of Women's Health, Obstetric and Neonatal Nurses, AHON, standards of care. Promptly identifying and responding to concerning fetal heart rate patterns, such as late decelerations or significant bradycardia, by initiating interventions like maternal repositioning, oxygen administration, and notifying the physician or certified nurse midwife, is crucial for preventing fetal hypoxia and distress. This proactive and systematic response demonstrates adherence to the principles of safe and effective obstetric nursing care, prioritizing patient safety and optimal outcomes. An incorrect approach that involves delaying notification of the physician or certified nurse midwife while continuing to observe the pattern without intervention fails to meet the standard of care. This delay could allow a potentially reversible fetal compromise to worsen, leading to adverse neonatal outcomes and violating the ethical obligation to act in the patient's best interest. Another incorrect approach, such as discontinuing monitoring prematurely due to perceived improvement without a clear clinical rationale or physician order, disregards the dynamic nature of fetal well-being and the potential for rapid deterioration. This action could mask ongoing issues and lead to missed opportunities for timely intervention. Finally, an approach that involves making a definitive diagnosis of fetal distress without consulting the physician or certified nurse midwife and initiating collaborative management is outside the scope of independent nursing practice and could lead to inappropriate or delayed interventions. The professional decision-making process for similar situations should involve a systematic assessment of the fetal heart rate tracing, considering the baseline rate, variability, acceleration, and decelerations. The nurse must then correlate these findings with the patient's clinical status, including uterine contractions and maternal vital signs. Based on this comprehensive assessment, the nurse should apply knowledge of established protocols and guidelines to determine the appropriate course of action, which may include initiating interventions, escalating care by notifying the physician or certified nurse midwife, and documenting all findings and actions meticulously. Collaboration and clear communication are paramount throughout the process. Question 4. Implementation of a standardized protocol for managing a sudden, unexpected drop in fetal heart rate accompanied by maternal hypotension in the delivery room. What is the most appropriate immediate nursing action? Option A. Delegate the assessment of maternal vital signs and fetal heart rate to a newly hired nursing assistant while the registered nurse begins to chart the event. Option B. Immediately contact the physician to report the fetal heart rate and maternal blood pressure changes and await further instructions before initiating any interventions. Option C. Focus on thoroughly documenting the fetal heart rate pattern and maternal vital signs in the electronic health record before taking any direct patient care actions. Option D. Immediately initiate interventions to improve maternal oxygenation and perfusion, such as positioning the patient, administering oxygen, and assessing vital signs, while simultaneously alerting the physician. The correct answer is D. Immediately initiate interventions to improve maternal oxygenation and perfusion, such as positioning the patient, administering oxygen, and assessing vital signs, while simultaneously alerting the physician. Explanation. This scenario is professionally challenging due to the dynamic and high-stakes nature of the delivery room, requiring rapid, evidence-based decision-making under pressure. The nurse's role is multifaceted, encompassing direct patient care, advocacy, and collaboration with the healthcare team. Adherence to established protocols and best practices is paramount to ensure the safety and well-being of both mother and infant. The correct approach represents best professional practice by prioritizing immediate, direct maternal assessment and intervention based on established obstetric emergency protocols. This aligns with the American College of Obstetricians and Gynecologists, ACOG guidelines, and the Association of Women's Health, Obstetric and Neonatal Nurses, AHON, standards of practice, which emphasize prompt recognition and management of obstetric emergencies. The nurse's responsibility includes continuous fetal monitoring, maternal vital sign assessment, and initiating interventions to stabilize the patient, thereby upholding the ethical principles of beneficence and non-maleficence. An incorrect approach that involves delaying direct maternal assessment to first contact the physician without initiating immediate interventions fails to meet the standard of care for an obstetric emergency. This could be considered a breach of professional duty, potentially violating guidelines that mandate prompt nursing action in critical situations. Another incorrect approach, such as delegating the primary maternal assessment to a less experienced team member without direct supervision during a suspected emergency, could also lead to delays in appropriate care and is contrary to established nursing practice standards that require experienced personnel to manage critical events. Furthermore, an approach that focuses solely on documentation before ensuring maternal stability neglects the immediate need for life-saving interventions, which is a fundamental ethical and professional failing. Professionals should employ a structured decision-making process that includes rapid assessment of the situation, identification of potential risks, recall and application of relevant protocols and best practices, clear and concise communication with the healthcare team, and timely initiation of appropriate interventions. This systematic approach ensures that patient safety remains the highest priority in the fast-paced delivery room environment. Question 5. Quality control measures reveal a need to enhance patient education regarding the physiological adaptations of pregnancy. A patient expresses a desire to understand how her body is changing, which approach by the inpatient obstetric nurse best assesses the patient's comprehension of the anatomy and physiology of the female reproductive system during pregnancy. Option A. Ask the patient to define terms such as fundus, placenta, and amniotic fluid. Option B. Observe the patient's nonverbal cues for signs of understanding while delivering a lecture on the menstrual cycle and ovulation. Option C. Ask the patient to describe in her own words how the uterus grows and changes to accommodate the fetus and how hormonal shifts influence these processes. Option D. Provide the patient with a detailed pamphlet on female reproductive anatomy and physiology and ask if she has any questions. The correct answer is C. Ask the patient to describe in her own words how the uterus grows and changes to accommodate the fetus and how hormonal shifts influence these processes. Explanation. Scenario analysis. This scenario presents a challenge in assessing a patient's understanding of a fundamental physiological process impacting her pregnancy. The difficulty lies in discerning the patient's actual comprehension versus her ability to articulate it, especially when dealing with potentially sensitive or complex anatomical concepts. Accurate assessment is crucial for effective patient education and ensuring informed consent for any interventions or management plans. Correct approach analysis. The correct approach demonstrates best professional practice by actively engaging the patient in a dialogue that probes her understanding of the physiological changes occurring during pregnancy. This involves asking open-ended questions that encourage the patient to explain concepts in her own words, allowing the nurse to identify any misconceptions or gaps in knowledge. This aligns with the principles of patient-centered care and the ethical obligation to provide clear, understandable information, as mandated by professional nursing standards and guidelines for patient education within the U.S. healthcare system. The focus is on assessing comprehension, not just recall of terms. Incorrect approach is analysis. One incorrect approach fails by relying solely on the patient's ability to repeat medical terminology. This is a superficial assessment that does not guarantee true understanding. The patient might be able to recite terms without grasping their functional significance, leading to a false sense of knowledge. This approach neglects the ethical imperative to ensure genuine patient comprehension, which is foundational to informed decision-making. Another incorrect approach is to assume the patient's understanding based on her general demeanor or stated desire to learn. While positive engagement is good, it does not substitute for a direct assessment of her grasp of the specific anatomical and physiological concepts relevant to her pregnancy. This overlooks the professional responsibility to verify understanding through targeted questioning. A further incorrect approach involves providing a lengthy lecture without first assessing the patient's baseline knowledge. This can be overwhelming and ineffective, as it may cover information the patient already knows or present it in a way that is not tailored to her learning needs. It fails to meet the standard of individualized patient education and can be seen as a missed opportunity for effective communication. Professional reasoning. Professionals should employ a teach-back method, which involves asking patients to explain in their own words what they need to know or do. This iterative process allows for clarification and reinforcement, ensuring that the patient truly understands the information provided. The decision-making process should prioritize assessment of comprehension over rote memorization, fostering a collaborative approach to care where the patient is an active participant in her health management. Question 6. Strategic planning requires a thorough understanding of normal pregnancy physiology to effectively manage patient care. A 30-year-old G2P1 patient at 32 weeks gestation presents to the labor and delivery unit reporting mild, intermittent shortness of breath and some swelling in her ankles that has worsened over the past week. She denies chest pain, palpitations, or significant dyspnea at rest. She has no significant past medical history. Which of the following approaches best reflects an understanding of normal pregnancy physiology in the initial assessment of this patient? Option A. Immediately initiate a workup for pulmonary embolism and preeclampsia due to the reported symptoms. Option B. Assess the patient's vital signs, lung sounds, cardiac assessment, and degree of edema, comparing these findings to expected physiological changes of pregnancy at 32 weeks gestation. Option C. Focus on the patient's subjective reports of shortness of breath and edema as definitive indicators of a serious complication requiring immediate intervention. Option D. Reassure the patient that these symptoms are common in late pregnancy and require no further investigation. The correct answer is A. Immediately initiate a workup for pulmonary embolism and preeclampsia due to the reported symptoms. Explanation. The scenario presents a common clinical situation where a pregnant patient exhibits signs that could indicate a deviation from normal pregnancy physiology. The professional challenge lies in accurately assessing these signs within the context of expected physiological changes of pregnancy and differentiating between normal adaptations and potential complications. This requires a nuanced understanding of the RNCOB scope of practice, which emphasizes evidence-based care for the inpatient obstetric patient. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's current physiological state, integrating subjective reports with objective findings. This aligns with the RNCOB certification focus on applying advanced knowledge to provide safe and effective care. Specifically, understanding the normal cardiovascular, respiratory, and metabolic adaptations of pregnancy is crucial for interpreting findings like mild edema or slight shortness of breath. The correct approach involves a systematic evaluation, considering the patient's gestational age and overall health status, and utilizing critical thinking to determine if further investigation or intervention is warranted. This adheres to the principle of providing individualized care based on a thorough understanding of normal pregnancy physiology, as expected within the RNCOB framework. An incorrect approach that focuses solely on the patient's subjective complaints without a thorough physiological assessment fails to consider the wide range of normal physiological changes that can occur during pregnancy. This could lead to unnecessary anxiety for the patient and potentially delay the identification of true complications. Ethically, it represents a failure to provide comprehensive care. Another incorrect approach that immediately assumes a pathological process without first establishing a baseline of normal physiological adaptation overlooks the unique physiological state of pregnancy. This could lead to overintervention, unnecessary testing, and increased healthcare costs. It may not align with the RNCOB's emphasis on evidence-based practice and avoiding iatrogenic harm. The professional reasoning process for similar situations should involve a systematic approach. First, recall and apply knowledge of normal pregnancy physiology relevant to the patient's gestational age and presenting symptoms. Second, conduct a thorough physical and subjective assessment, comparing findings to expected physiological norms. Third, utilize critical thinking to differentiate between normal adaptations and potential warning signs. Fourth, consult relevant evidence-based guidelines and protocols. Finally, communicate effectively with the patient and the healthcare team to ensure appropriate management and care planning. Question 7. Governance review demonstrates a need to reinforce best practices in labor progression assessment. A patient in active labor reports increasing pain and states, "I don't feel like anything is happening, and it's been hours." The nurse has been monitoring the patient's contractions, noting they are occurring approximately every 5-7 minutes and lasting about 45 seconds. The fetal heart rate has remained reassuring. Which of the following actions best reflects a comprehensive and evidence-based approach to reassessing this patient's labor progression? Option A. Perform a detailed cervical examination to assess dilation, effacement, and station. Palpate uterine contractions for frequency, duration, and intensity, and reevaluate fetal well-being. Option B. Document the patient's subjective report of pain and lack of progress, and continue routine monitoring without further immediate intervention. Option C. Reassure the patient that labor can be long and encourage her to rest, as the fetal heart rate is reassuring and contractions are occurring regularly. Option D. Increase the frequency of oxytocin infusion to stimulate stronger contractions, as the patient is reporting increased pain and perceived lack of progress. The correct answer is A. Perform a detailed cervical examination to assess dilation, effacement, and station. Palpate uterine contractions for frequency, duration, and intensity, and reevaluate fetal well-being. Explanation. Scenario analysis. This scenario presents a common challenge in inpatient obstetrics, accurately assessing labor progression in a patient experiencing irregular contractions and perceived lack of progress. The professional challenge lies in differentiating between normal variations in labor, the need for continued observation, and potential deviations requiring intervention, all while ensuring patient safety and adhering to evidence-based practice guidelines. The nurse must synthesize subjective patient reports with objective clinical findings to make timely and appropriate decisions. Correct approach analysis. The correct approach, which involves a comprehensive reassessment including cervical examination, palpation of contractions for frequency, duration, and intensity, and evaluation of fetal well-being, represents best professional practice. This aligns with established guidelines for labor management, such as those promoted by the American College of Obstetricians and Gynecologists, ACOG, and the Association of Women's Health, Obstetric and Neonatal Nurses, AHON. These guidelines emphasize a systematic and thorough evaluation of the laboring patient to identify deviations from expected progress and ensure fetal safety. A cervical examination is crucial for objectively measuring cervical change, dilation and effacement, and station, which are primary indicators of labor progression. Palpation of contractions provides objective data on the uterine activity, essential for understanding the forces of labor. Fetal well-being assessment, typically through electronic fetal monitoring or intermittent auscultation, is paramount to ensure the fetus is tolerating labor. This multifaceted approach ensures that clinical decisions are based on robust data, promoting optimal maternal and fetal outcomes, and adhering to the standard of care. Incorrect approach is analysis. One incorrect approach would be to solely rely on the patient's subjective report of pain and perceived lack of progress without performing objective assessments. This fails to meet the standard of care by neglecting objective data collection, which is essential for accurate labor assessment. Ethically, it could be considered a breach of duty of care, as it prioritizes subjective experience over objective clinical findings that are critical for identifying potential complications. Another incorrect approach would be to immediately initiate interventions such as oxytocin augmentation based solely on the patient's subjective complaints and a limited assessment of contraction frequency, without a thorough evaluation of cervical status or fetal well-being. This premature intervention could lead to iatrogenic complications for both mother and fetus, such as hyperstimulation or fetal distress, and deviates from evidence-based protocols that require a comprehensive assessment before initiating or escalating interventions. It also fails to consider the possibility of normal labor variations. A third incorrect approach would be to dismiss the patient's concerns and continue routine monitoring without a focused reassessment, assuming that the labor will eventually progress. This could lead to a delay in identifying and managing a true labor dystocia or fetal compromise, potentially resulting in adverse outcomes. This approach neglects the principle of vigilance in obstetric care and the importance of responding to patient cues that may indicate a deviation from normal. Professional reasoning. Professionals should approach this situation by first acknowledging the patient's concerns and then systematically gathering objective data. This involves a structured assessment that includes evaluating cervical changes, uterine activity, and fetal well-being. The decision-making process should be guided by established protocols and evidence-based practice guidelines, considering the patient's individual circumstances and risk factors. If objective data indicates a lack of progress or fetal compromise, appropriate intervention should be initiated promptly, with continuous reassessment to monitor response. If the assessment reveals normal labor patterns, reassurance and continued support are appropriate, with clear communication to the patient about findings and expectations. Question 8. Investigation of the most effective process optimization strategy for ensuring a safe and comprehensive discharge for a postpartum patient with pre-existing hypertension and a history of postpartum hemorrhage, who is eager to return home within 24 hours of delivery. Option A. Convene a multidisciplinary team conference involving the obstetrician, primary nurse, social worker, and case manager to review the patient's medical status, social support, and identified risks, and to collaboratively finalize the discharge plan and follow-up appointments. Option B. Rely solely on the primary nurse to educate the patient and her family on all aspects of postpartum care, medication management, and warning signs, without formal team input. Option C. Proceed with discharge based on the patient's verbal confirmation of readiness and the physician's verbal orders for medication refills, assuming her home support system is adequate. Option D. Delegate the entire discharge planning process to the least experienced nurse on the unit, with minimal oversight from senior staff. The correct answer is A. Convene a multidisciplinary team conference involving the obstetrician, primary nurse, social worker, and case manager to review the patient's medical status, social support, and identified risks, and to collaboratively finalize the discharge plan and follow-up appointments. Explanation. Scenario analysis. This scenario presents a common challenge in inpatient obstetric nursing, ensuring a safe and effective transition of care for a postpartum patient with a complex medical history. The challenge lies in balancing the patient's desire for timely discharge with the critical need for comprehensive follow-up to prevent readmission and ensure optimal maternal and infant well-being. The nurse must navigate potential communication gaps between healthcare providers, assess the patient's understanding of her condition and care plan, and coordinate resources effectively, all within the context of established discharge protocols. Correct approach analysis. The optimal approach involves a multidisciplinary team conference prior to discharge. This aligns with best practices in patient safety and quality improvement, as mandated by regulatory bodies like the Joint Commission in the U.S. context, which is the assumed jurisdiction for RNC-OB. Such a conference allows for a holistic review of the patient's medical status, social support, and identified risks. It ensures that all members of the care team, physicians, nurses, social workers, case managers, are aligned on the discharge plan, potential complications, and the specific follow-up instructions. This proactive coordination minimizes the risk of misinformation or conflicting advice, thereby optimizing the patient's transition to home and reducing the likelihood of adverse events or readmission. It directly supports the ethical principle of beneficence by ensuring the patient receives the highest standard of care throughout the continuum of care. Incorrect approach is analysis. One incorrect approach is to rely solely on the physician's verbal orders for discharge instructions without further team discussion. This creates a significant risk of incomplete information transfer and potential misinterpretation by the nursing staff or the patient. It fails to leverage the expertise of other disciplines, such as social work, which may be crucial for identifying barriers to follow-up care. E.g., transportation, financial concerns. Ethically, this approach could be seen as a failure to uphold the duty of care and ensure patient safety, potentially violating standards of practice that emphasize interdisciplinary collaboration. Another incorrect approach is to proceed with discharge based on the patient's stated readiness without a formal assessment of her understanding of the discharge instructions and her support system. Patient autonomy is important. It must be balanced with the nurse's professional responsibility to ensure the patient is truly prepared for self-care. This approach neglects the critical component of patient education validation and risk assessment, which is a cornerstone of safe discharge planning. Regulatory guidelines often emphasize patient education and the verification of understanding as essential elements of discharge. Failure to do so can lead to poor adherence to the care plan and increased risk of complications. A third incorrect approach is to delegate the entire discharge planning process to a junior nurse without adequate supervision or input from experienced team members. While delegation is a necessary nursing skill, complex discharge planning, especially for high-risk patients, requires the critical thinking and experience of seasoned professionals. This approach risks overlooking subtle but important aspects of the patient's condition or her home environment that could impact her recovery. It also fails to ensure consistent application of best practices and may not meet the standards of care expected for complex obstetric patients, potentially violating professional accountability and patient advocacy principles. Professional reasoning. Professionals should employ a structured, interdisciplinary approach to discharge planning. This involves early identification of patients requiring complex discharge needs, comprehensive assessment of physical, psychosocial, and environmental factors, and collaborative development of a personalized care plan. Regular team communication, patient and family education with teach-back methods, and clear documentation of all aspects of the discharge plan are paramount. Professionals should continuously evaluate the effectiveness of their discharge processes and seek opportunities for improvement based on patient outcomes and regulatory guidance. Question 9. What factors determine the most appropriate and timely nursing interventions when a laboring patient suddenly develops severe, continuous variable decelerations on the fetal monitor accompanied by maternal reports of intense abdominal pain and a sudden drop in blood pressure? Option A. The immediate assessment of maternal vital signs, fetal heart rate tracing, and the patient's subjective report of pain, followed by prompt notification of the obstetric provider and preparation for potential emergency interventions. Option B. Administering a bolus of intravenous fluids and repositioning the patient without immediately notifying the obstetric provider, assuming these interventions will resolve the fetal distress. Option C. Continuing to monitor the fetal heart rate closely and documenting the decelerations while waiting for the obstetric provider to complete their current patient assessment. Option D. Focusing solely on improving the fetal heart rate tracing through various maneuvers without a comprehensive maternal assessment or immediate communication with the obstetric provider. The correct answer is A. The immediate assessment of maternal vital signs, fetal heart rate tracing, and the patient's subjective report of pain, followed by prompt notification of the obstetric provider and preparation for potential emergency interventions. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in inpatient obstetrics, managing a patient experiencing a sudden, severe complication during labor. The professional challenge lies in the rapid assessment of the situation, accurate identification of the underlying cause, and timely, evidence-based intervention to ensure the safety of both mother and fetus. The urgency of the situation, coupled with the potential for rapid deterioration, demands a high level of clinical judgment, adherence to established protocols, and effective interprofessional communication. Correct approach analysis. The correct approach prioritizes immediate maternal and fetal assessment and stabilization, followed by prompt notification of the obstetric provider and preparation for potential emergency intervention. This aligns with established inpatient obstetric nursing standards of care, emphasizing the nurse's role in recognizing and responding to obstetric emergencies. Regulatory frameworks, such as those outlined by the American College of Obstetricians and Gynecologists, ACOG, and the Association of Women's Health, Obstetric and Neonatal Nurses, AHAN, underscore the importance of rapid response to fetal distress and maternal compromise. Ethically, this approach upholds the principles of beneficence and non-maleficence by acting swiftly to protect the well-being of both patients. Incorrect approaches analysis. One incorrect approach would be to delay notifying the obstetric provider while attempting to manage the situation solely through nursing interventions. This fails to recognize the limitations of nursing scope of practice in managing acute obstetric emergencies and violates the principle of timely consultation with the physician or certified nurse midwife, potentially leading to delayed definitive care and adverse outcomes. This also contravenes guidelines that mandate immediate escalation of care when a patient exhibits signs of significant distress. Another incorrect approach would be to focus solely on fetal monitoring without a comprehensive maternal assessment. While fetal distress is a critical concern, maternal vital signs, pain level, and other clinical indicators provide crucial context and may point to the underlying cause of fetal compromise, such as maternal hypovolemia or a hypertensive crisis. Neglecting maternal assessment can lead to misdiagnosis and inappropriate interventions, violating the holistic care principles expected in obstetric nursing. A third incorrect approach would be to administer medications without a clear diagnosis or physician order, or to administer medications that are not indicated for the suspected complication. This constitutes practicing beyond the scope of nursing practice and introduces unnecessary risks to the patient, potentially exacerbating the condition or causing new complications. It directly violates regulatory guidelines regarding medication administration and physician-directed medical management. Professional reasoning. Professionals should employ a systematic approach to obstetric emergencies. This involves 1. Rapidly assessing the ABC's airway breathing circulation of both mother and fetus. 2. Identifying key signs and symptoms of distress. 3. Initiating immediate nursing interventions to stabilize the patient, such as positioning, oxygen administration, and Roman IV fluid bolus if indicated. 4. Simultaneously, notifying the obstetric provider with a concise, accurate report of the patient's status. 5. Preparing for potential interventions, such as assisting with an emergency delivery or surgical intervention, based on the provider's orders and established protocols. This structured approach ensures that critical actions are taken concurrently and efficiently, maximizing the chances of a positive outcome. Question 10. When evaluating a pregnant patient's readiness for genetic screening and testing discussions, which approach best facilitates informed decision-making and upholds patient autonomy within the RNC-OB scope of practice? Option A. Focusing primarily on the technical aspects of the genetic tests and their laboratory procedures, assuming the patient will seek external information for personal relevance. Option B. Providing a detailed overview of all available genetic screening and testing options, including their accuracy, limitations, potential benefits, and psychosocial implications, while actively assessing the patient's understanding and addressing their concerns. Option C. Sharing personal anecdotes and opinions about the value of genetic testing in previous patient cases to guide the current patient's decision. Option D. Presenting the statistical likelihood of common genetic abnormalities and recommending specific tests based on the patient's demographic profile. The correct answer is B. Providing a detailed overview of all available genetic screening and testing options, including their accuracy, limitations, potential benefits, and psychosocial implications, while actively assessing the patient's understanding and addressing their concerns. Explanation. This scenario is professionally challenging because it requires the nurse to navigate complex ethical considerations, patient autonomy, and the rapidly evolving landscape of genetic screening and testing in obstetrics. Balancing the provision of accurate, unbiased information with the patient's personal values and beliefs is paramount. The nurse must ensure informed consent is truly informed, which necessitates understanding the nuances of genetic conditions, the limitations of screening and testing, and the potential psychosocial impacts on the patient and family. The correct approach represents best professional practice because it prioritizes patient-centered care and adherence to established ethical and regulatory guidelines for genetic counseling. This involves providing comprehensive, unbiased information about available screening and testing options, their benefits, limitations, and potential outcomes. It empowers the patient to make autonomous decisions aligned with their values and circumstances. This aligns with the principles of informed consent, patient autonomy, and the nurse's ethical obligation to advocate for the patient's well-being, as outlined in professional nursing standards and ethical codes. An incorrect approach that focuses solely on the statistical likelihood of a condition, without exploring the patient's understanding or concerns, fails to provide adequate counseling. This is a regulatory and ethical failure, because it bypasses the crucial step of assessing patient comprehension and addressing their individual needs and anxieties, thereby undermining the principle of informed consent. Another incorrect approach that presents personal opinions or recommendations about specific genetic tests is a significant ethical and regulatory failure. This violates the principle of professional neutrality and can unduly influence the patient's decision-making, compromising their autonomy and the integrity of the counseling process. The nurse's role is to educate and support, not to direct or persuade based on personal bias. A further incorrect approach that avoids discussing the potential psychosocial implications of genetic screening and testing is also professionally unacceptable. This is an ethical failure, as it neglects a critical aspect of patient care. Understanding the emotional, social, and familial impacts is vital for comprehensive counseling and for preparing the patient for potential results and their consequences. The professional decision-making process for similar situations should involve a systematic approach. First, assessing the patient's current knowledge and understanding of genetic screening and testing. Second, providing clear, accurate, and unbiased information about all available options, including their purpose, accuracy, limitations, and potential outcomes. Third, exploring the patient's values, beliefs, and concerns to tailor the counseling. Fourth, ensuring the patient understands the information and has the opportunity to ask questions. And finally, supporting the patient's autonomous decision-making process. This process is guided by ethical principles and regulatory requirements for patient care and informed consent. Question 11. The control framework reveals that a 32-week pregnant patient reports experiencing new-onset shortness of breath that has worsened over the past 24 hours. She denies chest pain or palpitations, but notes increased fatigue. The nurse is assessing the patient's current status. Which of the following assessment approaches best prioritizes identifying potential risks to the mother and fetus? Option A. Administering a prescribed bronchodilator immediately to address the reported shortness of breath, assuming it is related to pregnancy-induced respiratory changes. Option B. Initiating an immediate transfer to the intensive care unit for continuous cardiac monitoring without further initial assessment. Option C. Reassuring the patient that shortness of breath is a common symptom in late pregnancy and advising her to rest and drink more fluids. Option D. Performing a focused respiratory assessment including lung auscultation, checking oxygen saturation, and reviewing her prenatal record for any history of asthma or cardiac conditions. Correct answer is D. Performing a focused respiratory assessment including lung auscultation, checking oxygen saturation, and reviewing her prenatal record for any history of asthma or cardiac conditions. Explanation. The control framework reveals that a pregnant patient presenting with new-onset shortness of breath requires a comprehensive risk assessment to identify potential underlying causes, which can range from normal physiological changes of pregnancy to serious cardiopulmonary conditions. This scenario is professionally challenging because the signs and symptoms of maternal adaptations to pregnancy can overlap with those of critical obstetric emergencies, necessitating astute clinical judgment and a systematic approach to differentiate between the two. The correct approach involves a thorough maternal history, including pre-existing conditions and current pregnancy status, followed by a focused physical examination and targeted diagnostic investigations. This aligns with the AHAN, Association of Women's Health, Obstetric and Neonatal Nurses, standards of practice for obstetric nursing, which emphasize evidence-based assessment and intervention to ensure patient safety. Specifically, the nursing process, assessment, diagnosis, outcome identification, planning, implementation, and evaluation is paramount. Systematic assessment allows the nurse to identify deviations from normal physiological adaptations and to recognize early warning signs of potentially life-threatening conditions such as pulmonary embolism, preeclampsia with severe features, or peripartum cardiomyopathy. This proactive risk assessment is crucial for timely intervention and improved maternal outcomes, adhering to the ethical principles of beneficence and non-maleficence. An incorrect approach would be to attribute the shortness of breath solely to normal physiological changes of pregnancy, without a thorough assessment. This failure to investigate further could lead to a delay in diagnosing and treating a serious condition, violating the nursing duty of care, and potentially leading to adverse maternal or fetal outcomes. Such an approach would contravene regulatory guidelines that mandate comprehensive patient assessment and risk identification. Another incorrect approach would be to rely solely on a single diagnostic test without considering the patient's overall clinical presentation and history. This narrow focus might miss crucial information and lead to misdiagnosis. Ethically, this would represent a failure to provide holistic care and could be considered negligent. A third incorrect approach would be to escalate care prematurely without gathering sufficient data to support the urgency, potentially leading to unnecessary interventions and patient anxiety, though less severe than failing to assess adequately. However, in the context of new-onset shortness of breath in pregnancy, a more significant failure lies in underassessment rather than overassessment. Professional reasoning in such situations involves a continuous cycle of assessment, critical thinking, and communication. Nurses must be proficient in recognizing normal physiological changes of pregnancy while simultaneously being vigilant for signs of pathology. This requires a strong knowledge base of maternal adaptations and potential complications, coupled with effective communication with the patient, family, and the interdisciplinary healthcare team. When faced with ambiguous symptoms, the nurse should err on the side of caution, conducting a more thorough assessment and seeking consultation when necessary, always prioritizing patient safety and evidence-based practice as guided by professional standards and regulatory frameworks. Question 12. Stakeholder feedback indicates that some newly pregnant patients express significant anxiety regarding common early pregnancy symptoms and their underlying hormonal causes. A patient in her early weeks of gestation reports experiencing fatigue, nausea, and breast tenderness, and asks, "What exactly are these hormones doing to make me feel so sick and tired?" Which of the following nursing responses best addresses the patient's concern with accurate, patient-centered education? Option A. These are common symptoms of early pregnancy, and your body is just adjusting. We'll monitor you closely. Option B. The primary hormones involved are human chorionic gonadotropin, HCG, progesterone, and estrogen. HCG is produced by the developing placenta and signals the ovaries to continue producing progesterone and estrogen. Progesterone is crucial for maintaining the uterine lining and preventing contractions, while estrogen contributes to breast development and uterine growth. These hormonal shifts are responsible for many of the symptoms you're experiencing, including nausea and fatigue. Option C. It's important to be aware that these symptoms can sometimes be an early sign of a problem, so we need to watch out for any worsening signs. Option D. Your body is experiencing a huge surge of hormones right now, and that's why you're feeling this way. It's just part of being pregnant. The correct answer is A. These are common symptoms of early pregnancy, and your body is just adjusting. We'll monitor you closely. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to synthesize complex hormonal changes during pregnancy with the practical application of patient education. The challenge lies in translating scientific knowledge into understandable and actionable advice for a pregnant patient, ensuring accuracy, and addressing potential patient anxieties or misconceptions. The nurse must also consider the evolving nature of pregnancy and the potential for individual variations in hormonal responses. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the patient's stated concern with accurate, evidence-based information tailored to the physiological realities of early pregnancy. By explaining the role of progesterone and estrogen in maintaining the uterine lining and supporting fetal development, the nurse provides a clear, concise, and reassuring explanation. This aligns with the AHAN Association of Women's Health, Obstetric and Neonatal Nurses standards of practice, which emphasize patient education and empowerment through clear communication and accurate information dissemination. This approach fosters trust and promotes patient adherence to recommended care. Incorrect approaches analysis. One incorrect approach fails to provide a specific, scientifically grounded explanation for the patient's symptoms. Instead, it offers a vague reassurance that everything will be fine. This lacks the depth of information required for effective patient education and may leave the patient feeling unheard or uninformed, potentially leading to increased anxiety. Ethically, this approach falls short of the nurse's duty to inform and educate. Another incorrect approach focuses on a potential complication without sufficient evidence or context. While vigilance for complications is crucial, prematurely introducing information about miscarriage without a clear indication or patient-specific risk factors can cause undue distress and anxiety. This deviates from a patient-centered approach and may violate principles of beneficence by causing unnecessary harm through fear. A third incorrect approach offers a simplistic explanation that does not accurately reflect the complex hormonal interplay in early pregnancy. For instance, attributing all symptoms solely to hormone surges, without specifying the key hormones and their functions, is an oversimplification that can lead to a misunderstanding of the physiological processes. This lack of precision can undermine patient comprehension and trust in the nurse's expertise. Professional reasoning. Professionals should approach patient education by first actively listening to and validating the patient's concerns. Then they should access and apply current, evidence-based knowledge relevant to the patient's stage of pregnancy and reported symptoms. Communication should be clear, concise, and tailored to the patient's level of understanding, avoiding jargon. The nurse should assess for patient comprehension and provide opportunities for questions. This systematic approach ensures that patient education is not only informative but also supportive and empowering, adhering to ethical principles of autonomy, beneficence, and non-maleficence, and aligning with professional standards of care. Question 13. Process analysis reveals that an expectant mother in her third trimester expresses significant anxiety regarding her baby's size, stating, "I'm so worried my baby isn't growing enough. I feel like something is wrong." As an RNC OB, how should you best address her concerns while adhering to professional and ethical standards related to fetal development and growth? Option A. Reassure her that everything is likely fine and that babies grow at different rates, without delving into specific details of fetal growth assessment to avoid causing further worry. Option B. Advise her to stop worrying and focus on enjoying the rest of her pregnancy, suggesting that her anxiety is likely unfounded and not beneficial to the baby. Option C. Provide a detailed lecture on the complex physiological processes of fetal growth, including specific percentile ranges and potential genetic factors, to ensure she is fully informed. Option D. Validate her feelings. Explain that fetal growth can vary and discuss the methods used to assess growth, offering to review her ultrasound reports with her to clarify any findings and answer her specific questions. The correct answer is D. Validate her feelings, explain that fetal growth can vary and discuss the methods used to assess growth, offering to review her ultrasound reports with her to clarify any findings and answer her specific questions. Explanation. Scenario analysis. This scenario presents an ethical dilemma common in inpatient obstetrics, where a nurse must balance patient autonomy, beneficence, and the ethical obligation to provide accurate information regarding fetal development and potential risks. The challenge lies in discerning how much information to disclose to a patient who expresses anxiety about fetal growth, without causing undue distress or overwhelming them with complex medical details that may not be fully understood. The nurse must also consider the potential for misinterpretation of information and the impact on the patient's emotional well-being and decision-making process. Correct approach analysis. The correct approach prioritizes open, honest, and empathetic communication while tailoring the information to the patient's expressed needs and understanding. This aligns with the ethical principle of patient autonomy, ensuring the patient is informed to make decisions about their care. It also upholds beneficence by providing relevant information that can alleviate anxiety and promote proactive management if necessary. The nurse's role is to facilitate understanding, not to dictate outcomes or instill fear. This approach respects the patient's right to know and participate in their care, consistent with professional nursing standards and ethical guidelines that emphasize patient-centered care and informed consent. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's concerns without adequate exploration. This fails to acknowledge the patient's emotional state and can erode trust, violating the ethical principle of non-maleficence by potentially causing psychological harm through neglect. It also undermines patient autonomy by not providing the necessary information for informed decision-making. Another incorrect approach is to overwhelm the patient with excessive, highly technical medical jargon about fetal growth parameters and potential complications without assessing their comprehension. This can lead to increased anxiety and confusion, failing the principle of beneficence by causing distress rather than providing helpful information. It also risks misinterpretation, which can lead to poor decision-making. A third incorrect approach is to offer reassurance without a factual basis or to downplay potential concerns that may warrant further investigation. This is a failure of veracity and can lead to a false sense of security, potentially delaying necessary interventions and violating the principle of beneficence by not acting in the patient's best interest. Professional reasoning. Professionals should employ a patient-centered communication model. This involves active listening to understand the patient's specific concerns and anxieties. The nurse should then assess the patient's current level of understanding and tailor the explanation of fetal development and growth accordingly, using clear, accessible language. The focus should be on providing relevant information, explaining normal variations, and outlining any potential concerns in a calm and reassuring manner, while also empowering the patient to ask questions and express their feelings. This process ensures that the patient receives information that is both accurate and understandable, fostering a collaborative approach to their obstetric care. Question 14. The risk matrix shows a pregnant individual with gestational diabetes mellitus, a history of preterm labor in a previous pregnancy, and current use of opioids for chronic pain. The nurse is preparing for the anticipated birth. Which of the following approaches best prioritizes the newborn's well-being and anticipates potential complications? Option A. Implement a standardized protocol for neonatal abstinence syndrome, NAS, screening and management, and arrange for early consultation with a neonatologist. Option B. Initiate routine newborn care, including immediate skin-to-skin contact and breastfeeding, and monitor for any obvious signs of distress. Option C. Focus on ensuring the mother is comfortable and stable post-delivery, with the understanding that the newborn will be assessed by the pediatrician within 24 hours. Option D. Alert the Neonatal Intensive Care Unit, NICU, team for immediate assessment of the newborn due to the presence of multiple significant maternal risk factors. The correct answer is B. Initiate routine newborn care, including immediate skin-to-skin contact and breastfeeding, and monitor for any obvious signs of distress. Explanation. This scenario presents a common challenge in inpatient obstetrics, identifying and managing potential newborn complications based on maternal risk factors. The professional challenge lies in accurately interpreting the significance of various maternal conditions and their potential impact on the neonate, necessitating a proactive and evidence-based approach to risk assessment and intervention. Careful judgment is required to differentiate between routine newborn care and situations demanding immediate or specialized attention, ensuring optimal outcomes for both mother and infant. The correct approach represents best professional practice by prioritizing a comprehensive assessment of maternal risk factors to anticipate and mitigate potential newborn complications. This aligns with the principles of evidence-based practice and patient safety, as mandated by professional nursing standards and regulatory bodies governing perinatal care in the United States. Proactive risk assessment allows for timely implementation of appropriate interventions, such as enhanced neonatal monitoring, specialized feeding strategies, or prompt consultation with pediatric specialists, thereby minimizing the risk of adverse neonatal outcomes. This approach upholds the ethical obligation to provide competent and compassionate care, advocating for the well-being of the newborn. An incorrect approach that relies solely on the absence of immediate visible distress in the newborn fails to acknowledge the insidious nature of certain neonatal conditions that may not be immediately apparent. This oversight represents a failure to adhere to established protocols for risk assessment and can lead to delayed diagnosis and treatment, potentially resulting in significant morbidity or mortality. Ethically, this approach breaches the duty of care by not acting on known risk factors. Another incorrect approach that involves delaying interventions until a specific threshold of symptoms is met ignores the principle of early detection and prevention. Many neonatal complications are more effectively managed when addressed in their nascent stages. Waiting for overt signs of distress can mean missing critical windows for intervention, thereby increasing the complexity of care and potentially compromising the infant's long-term health. This approach also contravenes regulatory guidelines that emphasize proactive management of identified risks. A further incorrect approach that focuses exclusively on maternal comfort without considering the neonate's specific needs overlooks the interconnectedness of maternal and infant well-being. While maternal comfort is crucial, it should not supersede the assessment and management of potential neonatal risks. This can lead to a failure to implement necessary neonatal interventions, thereby compromising the infant's health and potentially violating professional standards of care that mandate a holistic approach to the perinatal continuum. The professional decision-making process for similar situations should involve a systematic review of maternal history and current status, identification of all potential neonatal risk factors, and application of evidence-based guidelines for newborn assessment and management. This includes understanding the pathophysiology of common newborn conditions, recognizing their early signs and symptoms, and knowing when and how to escalate care. Continuous learning and adherence to current best practices are essential for effective risk assessment and intervention in inpatient obstetrics. Question 15. The evaluation methodology shows that a pregnant patient admitted for observation due to mild preeclampsia appears distracted and uninterested when the nurse begins to explain routine prenatal care recommendations and self-care strategies. The nurse needs to effectively educate this patient. Which of the following approaches best ensures the patient receives and understands the necessary information? Option A. Document that prenatal education was provided, assuming the patient will seek clarification if needed, and move on to other patient care tasks. Option B. Deliver a comprehensive, standardized lecture on all aspects of prenatal care and self-care, assuming the patient will absorb the information over time. Option C. Delegate the entire responsibility of prenatal education to the patient's partner, who is present, without direct assessment of the patient's comprehension. Option D. Assess the patient's current understanding of prenatal care, identify any potential barriers to learning, and collaboratively develop a personalized education plan using appropriate teaching methods. The correct answer is D. Assess the patient's current understanding of prenatal care, identify any potential barriers to learning, and collaboratively develop a personalized education plan using appropriate teaching methods. Explanation. Scenario analysis. This scenario presents a common challenge in inpatient obstetric nursing, ensuring effective patient education on prenatal care and self-care when the patient exhibits a lack of engagement and potential barriers to understanding. The challenge lies in balancing the nurse's responsibility to provide essential health information with the patient's autonomy and individual learning needs, all within the context of a potentially time-constrained hospital environment. Accurate assessment of the patient's readiness to learn and tailoring the education accordingly are paramount to promoting positive health outcomes and adherence to recommended practices. Correct approach analysis. The correct approach involves a patient-centered strategy that prioritizes assessing the patient's current knowledge, identifying potential barriers to learning, and then collaboratively developing a personalized education plan. This aligns with the principles of patient advocacy and evidence-based practice, which are foundational to nursing care and are implicitly supported by regulatory frameworks governing patient education and informed consent. By actively involving the patient in the process and adapting the teaching methods, the nurse maximizes the likelihood of comprehension and retention, thereby empowering the patient to actively participate in her prenatal care and self-care. This approach respects the patient's dignity and promotes a therapeutic relationship, essential for effective health education. Incorrect approaches analysis. One incorrect approach involves delivering a standardized, comprehensive lecture on prenatal care without first assessing the patient's understanding or readiness to learn. This fails to acknowledge individual learning styles and needs, potentially overwhelming the patient and leading to poor retention. It can be seen as a failure to provide patient-centered care, a core tenet of nursing practice. Another incorrect approach is to assume the patient understands the information provided and to simply document that education was given, without any attempt to verify comprehension. This neglects the nurse's ethical and professional responsibility to ensure the patient has grasped the critical information necessary for her health and the health of her fetus. It could lead to non-adherence to important prenatal recommendations, posing a risk to both mother and baby. A third incorrect approach is to delegate the entire responsibility of prenatal education to another healthcare professional without ensuring continuity of care or that the patient's specific needs have been addressed. While collaboration is important, the primary nurse has a direct responsibility to ensure the patient receives adequate and understandable education regarding her current care plan. Professional reasoning. When faced with a patient who appears disengaged or has potential learning barriers, the professional decision-making process should begin with a thorough assessment of the patient's current knowledge, beliefs, and readiness to learn. This involves open-ended questions and active listening. Next, identify any barriers such as language, literacy, anxiety, or cultural factors. Based on this assessment, the nurse should collaboratively develop a personalized education plan, breaking down information into manageable chunks, using various teaching modalities, visual aids, demonstrations, and allowing ample opportunity for questions and clarification. Regular checks for understanding are crucial throughout the process. Documentation should reflect the assessment, the individualized plan, the teaching methods used, and the patient's demonstrated comprehension. Question 16. Operational review demonstrates a postpartum patient reports increasing perineal pain and a sensation of fullness in her vaginal area, despite receiving scheduled analgesia. The nurse is preparing to conduct a postpartum assessment. Which of the following actions best reflects the immediate priority for this patient's physiological assessment? Option A. Perform a thorough fundal height and tone assessment, evaluate lochia characteristics, and assess vital signs, paying close attention to any signs of hypovolemia. Option B. Administer an additional dose of prescribed opioid analgesia to manage the patient's reported pain. Option C. Document the patient's subjective report of pain and fullness and instruct her to report if symptoms worsen significantly. Option D. Focus primarily on the patient's vital signs, specifically her blood pressure and pulse, to rule out systemic instability. The correct answer is A. Perform a thorough fundal height and tone assessment, evaluate lochia characteristics, and assess vital signs, paying close attention to any signs of hypovolemia. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to integrate knowledge of normal postpartum physiological changes with the ability to identify subtle deviations that could indicate a serious complication. The postpartum period is dynamic, with rapid hormonal shifts and organ system adjustments. Recognizing the significance of a patient's subjective report of symptoms in the context of these expected changes demands astute clinical judgment and a thorough understanding of the underlying pathophysiology. The challenge lies in differentiating between expected postpartum sensations and early signs of potentially life-threatening conditions, such as postpartum hemorrhage or thromboembolism. Correct approach analysis. The correct approach prioritizes a comprehensive assessment that includes a detailed history, physical examination, and vital sign monitoring, specifically focusing on signs and symptoms related to the involution of the uterus and potential complications. This aligns with the AHAN, Association of Women's Health, Obstetric and Neonatal Nurses, standards of practice for postpartum care, which emphasize ongoing assessment and early identification of deviations from the norm. By systematically evaluating the patient's fundal height, tone, lochia, vital signs, and subjective complaints, the nurse can accurately assess the physiological status and determine if the patient's experience is within the expected range of postpartum recovery or indicative of a problem requiring intervention. This approach upholds the ethical principle of beneficence by ensuring the patient receives timely and appropriate care to prevent adverse outcomes. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's complaints as normal postpartum discomfort without a thorough assessment. This fails to adhere to the nursing process, which mandates a comprehensive evaluation of the patient's condition. Ethically, this approach breaches the duty of care and could lead to delayed diagnosis and treatment, violating the principle of non-maleficence. Regulatory frameworks, such as those guiding nursing practice within the U.S., require nurses to assess and monitor patients for potential complications. Another incorrect approach would be to focus solely on vital signs and neglect the subjective report of pain or discomfort. While vital signs are crucial, they may not always reflect early signs of distress, especially in the postpartum period where physiological reserves can be altered. This oversight could miss critical indicators of complications, like developing postpartum hemorrhage or infection, which often present with subjective symptoms before significant vital sign changes occur. This approach is inconsistent with best practices that advocate for a holistic patient assessment. A third incorrect approach might involve administering pain medication without a thorough assessment to determine the underlying cause of the discomfort. While pain management is important, it should not be a substitute for identifying and addressing the root cause of the symptom. This could mask a serious underlying condition, leading to a delay in appropriate medical or surgical intervention, and thus failing to meet the standard of care expected in postpartum nursing. Professional reasoning. Professionals should employ a systematic approach to postpartum assessment. This involves starting with a broad overview of the patient's status, then delving into specific physiological systems affected by childbirth. The nursing process, assessment, diagnosis, planning, implementation, evaluation, is the guiding framework. When a patient reports symptoms, the professional should always consider the potential for both normal physiological adaptation and pathological processes. This requires a strong knowledge base of postpartum changes and a critical thinking approach to differentiate between the two. Collaboration with the healthcare team, including physicians and other nurses, is also essential when uncertainty exists or when a complication is suspected. Question 17. The monitoring system demonstrates that a pregnant patient in her second trimester has a consistent intake of processed foods high in sodium and sugar, with limited consumption of fruits, vegetables, and lean proteins. The nurse is tasked with addressing these nutritional considerations. Which of the following approaches best aligns with current inpatient obstetric nursing best practices and regulatory guidelines for promoting optimal maternal and fetal health? Option A. Conduct a detailed dietary assessment. Explore the patient's food preferences and cultural background, and collaboratively develop a personalized, evidence-based nutrition plan that addresses her specific needs and potential barriers to adherence. Option B. Focus primarily on restricting the patient's intake of processed foods without offering specific alternatives or addressing the underlying reasons for her current dietary patterns. Option C. Inform the patient that her current diet is unacceptable and that she must immediately change her eating habits to avoid complications, without further discussion or collaborative planning. Option D. Provide the patient with a standardized pamphlet outlining general healthy eating guidelines for pregnancy and advise her to follow it. The correct answer is D. Provide the patient with a standardized pamphlet outlining general healthy eating guidelines for pregnancy and advise her to follow it. Explanation. Scenario analysis. This scenario presents a common challenge in inpatient obstetric nursing, where a patient's lifestyle choices directly impact their pregnancy. The nurse must balance providing evidence-based nutritional guidance with respecting patient autonomy and addressing potential barriers to adherence, all within the framework of established clinical guidelines and patient safety. The professional challenge lies in delivering this sensitive information effectively, ensuring the patient understands the implications for both herself and her fetus, and collaboratively developing a plan that is both medically sound and realistically achievable for the patient. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's current dietary habits, understanding her cultural background, socioeconomic factors, and personal preferences. This information is crucial for tailoring personalized, evidence-based nutritional recommendations that are culturally sensitive and practical. The nurse should then engage in shared decision-making, educating the patient on the risks associated with inadequate nutrition and the benefits of specific dietary changes, such as increased folic acid and iron intake, and the avoidance of certain foods. This aligns with the principles of patient-centered care and promotes adherence by empowering the patient. Regulatory frameworks for RNC OB certification emphasize evidence-based practice and patient education, ensuring that care provided is safe, effective, and respects the patient's right to informed consent and participation in her care plan. Incorrect approach is analysis. One incorrect approach involves providing generic, one-size-fits-all dietary advice without considering the patient's individual circumstances. This fails to acknowledge the complexities of nutrition in pregnancy and can lead to recommendations that are difficult or impossible for the patient to follow, thereby undermining the effectiveness of the intervention and potentially leading to suboptimal maternal and fetal outcomes. This approach neglects the ethical imperative to provide individualized care and may violate guidelines that stress personalized patient education. Another incorrect approach is to focus solely on restricting certain foods without a thorough understanding of the patient's current nutritional status or her ability to replace those nutrients with healthier alternatives. This can inadvertently lead to deficiencies and may not address the root causes of poor dietary habits. Ethically, this approach can be perceived as judgmental and may alienate the patient, hindering the development of a trusting therapeutic relationship. It also fails to meet the standard of care that requires a holistic assessment. A third incorrect approach is to dismiss the patient's concerns or preferences regarding her diet, assuming that medical recommendations should always supersede personal choices. While patient safety is paramount, effective nutritional management in pregnancy requires collaboration. Ignoring the patient's perspective can lead to non-adherence and a sense of disempowerment, which is contrary to best practices in patient education and shared decision-making. This approach can also create ethical dilemmas related to patient autonomy and the nurse's role as an advocate. Professional reasoning. Professionals should approach this situation by first conducting a thorough nutritional assessment, including a dietary history, identifying any cultural or personal beliefs that influence food choices, and assessing for potential barriers to healthy eating. Following this, they should engage in open and non-judgmental communication with the patient, explaining the importance of specific nutrients and dietary patterns for a healthy pregnancy, using clear and understandable language. Collaborative goal setting, where the patient actively participates in developing a realistic and achievable dietary plan, is essential. This process should be documented, and follow-up provided to monitor progress and offer ongoing support. Question 18. System analysis indicates that a postpartum mother expresses a strong desire to breastfeed her newborn. However, during the initial feeding attempt, the infant appears disorganized at the breast, and the mother reports discomfort. Which of the following approaches best reflects a risk assessment strategy for providing effective breastfeeding support in this inpatient obstetric setting? Option A. Focus solely on the infant's weight gain trajectory over the next 24 hours, as this is the primary indicator of successful feeding, and adjust interventions based on that data alone. Option B. Immediately recommend formula supplementation to ensure adequate infant intake, as discomfort and disorganized feeding can indicate a problem that needs rapid resolution. Option C. Conduct a thorough assessment of the infant's latch, the mother's positioning, and the mother's understanding of feeding cues, while also inquiring about her pain level and offering immediate comfort measures and education on latch techniques. Option D. Reassure the mother that discomfort is normal during initial breastfeeding attempts and encourage her to continue trying without further assessment, as the infant will eventually learn to latch effectively. The correct answer is C. Conduct a thorough assessment of the infant's latch, the mother's positioning, and the mother's understanding of feeding cues, while also inquiring about her pain level and offering immediate comfort measures and education on latch techniques. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to balance the mother's stated preferences with evidence-based practices for optimal infant feeding and maternal well-being, while also navigating potential cultural or personal beliefs that may influence feeding choices. The nurse must assess the situation holistically, considering the mother's physical recovery, the infant's needs, and the mother's readiness and understanding of breastfeeding support. Accurate risk assessment is crucial to identify potential barriers to successful breastfeeding and to implement timely, appropriate interventions. Correct approach analysis. The correct approach involves a comprehensive assessment of the mother's physical and emotional readiness, the infant's latch and feeding cues, and the mother's understanding of breastfeeding techniques and support resources. This aligns with the principles of patient-centered care, which is a cornerstone of professional nursing practice, and is implicitly supported by guidelines promoting optimal infant and maternal health outcomes. By identifying potential challenges early, the nurse can proactively offer tailored education and support, thereby promoting successful breastfeeding initiation and continuation, which is associated with numerous health benefits for both mother and infant. This approach prioritizes the mother's autonomy while ensuring she has the information and support to make informed decisions and achieve her feeding goals, consistent with ethical nursing practice and the promotion of public health. Incorrect approach is analysis. One incorrect approach would be to solely rely on the mother's initial statement of intent to breastfeed without further assessment. This fails to acknowledge that readiness can fluctuate and that underlying issues, e.g., pain, poor latch, lack of knowledge, can quickly derail intentions. Ethically, this approach neglects the nurse's responsibility to provide comprehensive education and support to facilitate successful breastfeeding, potentially leading to suboptimal infant nutrition and maternal distress. Another incorrect approach would be to immediately recommend formula supplementation without a thorough assessment of the infant's feeding effectiveness and the mother's ability to breastfeed. This premature recommendation can undermine the mother's confidence and create a perception that breastfeeding is not viable, even if temporary support could resolve the issue. This contradicts the goal of promoting breastfeeding as the primary feeding method when appropriate, and may not align with hospital policies or public health recommendations that encourage breastfeeding. A third incorrect approach would be to focus exclusively on the infant's weight gain, without considering the mother's breastfeeding experience and comfort. While infant weight is important, a sole focus on this metric can overlook maternal challenges that are contributing to feeding difficulties. This narrow focus can lead to interventions that do not address the root cause of the feeding problem and can negatively impact the mother-infant dyad's overall feeding journey. Professional reasoning. Professionals should employ a systematic approach to breastfeeding support. This begins with establishing rapport and understanding the mother's goals. Next, a physical assessment of both mother and infant is conducted, focusing on signs of readiness, comfort, and effective latch. Education should be ongoing and tailored to the mother's learning style and identified needs. Crucially, a risk assessment for potential breastfeeding challenges should be performed, considering factors such as maternal health conditions, infant anatomy, previous breastfeeding experiences, and psychosocial support. Based on this comprehensive assessment, individualized interventions and support strategies are developed and implemented, with ongoing evaluation and adjustment as needed. This iterative process ensures that care is responsive to the evolving needs of the mother-infant dyad and aligns with best practices for promoting breastfeeding success. Question 19. Quality control measures reveal their new fetal monitoring system offers advanced data analytics and remote access capabilities. Which of the following approaches best represents a responsible and evidence-based integration of this technology into labor management? Option A. Conducting a thorough review of peer-reviewed literature and institutional data to assess the technology's impact on maternal and neonatal outcomes, patient safety, and staff workflow before widespread adoption. Option B. Prioritizing the adoption of the new system due to its lower initial purchase price compared to existing technologies, assuming it will provide comparable monitoring. Option C. Implementing the new system across all laboring patients after a brief orientation for nursing staff, based on its perceived efficiency and potential for remote oversight. Option D. Relying on testimonials from a few early adopters in other facilities, and the vendor's promotional materials to justify its immediate implementation. The correct answer is C. Implementing the new system across all laboring patients after a brief orientation for nursing staff, based on its perceived efficiency and potential for remote oversight. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the nurse to balance the benefits of technological advancements in labor management with the potential risks and the need for individualized patient care. The rapid evolution of technology means nurses must stay current with best practices, understand the limitations of devices, and critically evaluate their application in diverse clinical situations. Ensuring patient safety, informed consent, and adherence to established protocols are paramount, especially when technology is involved. Correct approach analysis. The correct approach emphasizes a comprehensive, evidence-based evaluation of the technology's impact on patient outcomes and safety. This aligns with the core principles of quality improvement and patient-centered care mandated by regulatory bodies overseeing nursing practice in the U.S. Specifically, it reflects the commitment to using technology judiciously, ensuring it enhances, rather than compromises, the quality of care and patient safety. This approach prioritizes data-driven decision-making and continuous improvement, which are fundamental to maintaining professional standards and meeting the expectations of certifying bodies like the NCC, National Certification Corporation, for RNC OB. Incorrect approaches analysis. One incorrect approach focuses solely on the novelty and perceived efficiency of the technology, without rigorous evaluation of its impact on patient outcomes or safety. This violates the ethical obligation to provide evidence-based care and could lead to the adoption of technologies that are not proven to be beneficial or may even introduce new risks, contravening guidelines from professional organizations and potentially state nursing practice acts that require nurses to practice within their scope and based on current knowledge. Another incorrect approach prioritizes cost-effectiveness over patient outcomes and safety. While fiscal responsibility is important, it must never supersede the well-being of the patient. Adopting technology based primarily on cost without demonstrating its efficacy and safety would be a significant ethical and regulatory failure, potentially violating patient advocacy principles and the duty of care. A third incorrect approach involves relying on anecdotal evidence or the opinions of a few colleagues rather than systematic data collection and analysis. Professional nursing practice, particularly in specialized areas like obstetrics, demands a commitment to research utilization and evidence-based practice. Decisions about technology adoption must be grounded in robust data, not personal preference or informal consensus, to ensure the highest standard of care and compliance with professional accountability. Professional reasoning. Professionals should approach the integration of new technology by first identifying a clear clinical need or opportunity for improvement. This should be followed by a thorough literature review to understand existing evidence regarding the technology's efficacy, safety, and potential impact on patient populations. A pilot study or phased implementation, with clear metrics for success and safety monitoring, is often advisable. Ongoing evaluation, data collection, and feedback mechanisms are crucial to ensure the technology continues to meet its intended purpose and to identify any unforeseen issues. Collaboration with interdisciplinary teams, including physicians, IT specialists, and quality improvement personnel, is essential throughout the process. Adherence to institutional policies and procedures, as well as relevant professional standards and regulatory guidelines, must be maintained at all stages. Question 20. Market research demonstrates that expectant mothers frequently access health information from various online sources, which may not always be accurate or evidence-based. During a routine prenatal visit, a patient expresses significant anxiety about a specific dietary restriction she read about online, claiming it is crucial for preventing a rare birth defect. As an RNC OB, what is the most appropriate initial nursing action? Option A. Refer the patient to a registered dietitian for a comprehensive dietary evaluation without further discussion. Option B. Advise the patient to disregard all online information and only follow the advice given by her healthcare provider. Option C. Validate the patient's feelings and concerns, then provide accurate, evidence-based information regarding nutrition in pregnancy, addressing her specific dietary question and assessing her understanding. Option D. Immediately recommend a specific prenatal vitamin supplement that the patient can take to counteract any potential dietary deficiencies. The correct answer is C. Validate the patient's feelings and concerns, then provide accurate, evidence-based information regarding nutrition in pregnancy, addressing her specific dietary question and assessing her understanding. Explanation. Scenario analysis. This scenario presents a common challenge in prenatal care where a patient expresses concerns based on information obtained from non-professional sources. The professional challenge lies in balancing the patient's autonomy and right to information with the nurse's responsibility to provide evidence-based, accurate, and safe care within the established regulatory framework for prenatal services. It requires careful communication, critical assessment of the patient's understanding, and adherence to established protocols for managing patient concerns and providing education. Correct approach analysis. The correct approach prioritizes patient education and assessment of understanding within the scope of professional nursing practice and regulatory guidelines. This involves actively listening to the patient's concerns, validating their feelings, and then providing accurate, evidence-based information that addresses their specific questions. It also includes assessing the patient's comprehension and offering further clarification or resources. This aligns with the principles of informed consent, patient-centered care, and the nurse's role as an educator and advocate, all of which are implicitly or explicitly supported by U.S. federal and state regulations governing healthcare provision, including those overseen by bodies like the Centers for Medicare and Medicaid Services, CMS, and state boards of nursing. The focus is on empowering the patient with accurate knowledge to make informed decisions about their pregnancy. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's concerns or information source outright. This fails to acknowledge the patient's autonomy and right to express their concerns, potentially eroding trust and creating a barrier to effective communication. Ethically, it can be seen as paternalistic and disrespectful. From a regulatory standpoint, it could be interpreted as a failure to provide adequate patient education and support, which are fundamental aspects of quality prenatal care mandated by various healthcare regulations. Another incorrect approach is to immediately recommend or prescribe interventions based solely on the patient's stated concern without a thorough assessment or providing evidence-based information. This bypasses the critical step of understanding the patient's specific situation and the scientific basis for any recommended action. It risks providing inappropriate care and could violate regulations related to scope of practice and evidence-based medicine. A third incorrect approach is to simply refer the patient to an external source without first addressing their immediate concerns or providing context. While referrals are important, a complete abdication of the nurse's educational role is not appropriate. The nurse has a responsibility to provide initial education and support, and to ensure the patient understands the referral and its purpose. This could be seen as a failure to meet the patient's immediate educational needs as part of their ongoing prenatal care. Professional reasoning. Professionals should approach such situations by employing a patient-centered communication model. This involves active listening, empathy, and a non-judgmental attitude. The nurse should first seek to understand the patient's specific concerns and the source of their information. Then, they should provide accurate, evidence-based information in a clear and understandable manner, addressing the patient's questions directly. This should be followed by an assessment of the patient's understanding and an offer of further support or resources. This systematic approach ensures that patient care is both compassionate and compliant with professional standards and regulatory requirements.